My name is Dr. Otha Myles. I'm the medical director at ArchWell Health in Overland, Missouri. I decided at a very young age to become a doctor based on my experience with my mother. She was a devout religious person who felt it was her duty to go around our community and take care of members of our church who didn't come to services on Sunday. And so I was the kid that kind of went along with her, knocking on doors and making sure that everyone was okay. Now, mind you, I was not a doctor, I was not a nurse, I didn't have all those services, but we did whatever we could to provide care for those patients. And so here at ArchWell Health, I feel like I get an opportunity to almost do the same thing, just providing whatever care we can to meet their needs wherever they are. So when I look at these patients, they're just not numbers to me, but they're like family to me. I sometimes see my mother in some of these patients, or my father, or my brothers and sisters in some of these patients. So I want to make sure that I'm giving them good quality care, answering their questions, and making sure that they have the outcome that we want. And that's good positive outcomes, whether it's diabetes or hypertension or heart failure, whatever condition they may have. Our goal is to try to keep them out of the hospital, keep them out of urgent cares, and keep them out of emergency rooms. Well, here at ArchWell Health, we're able to treat the whole patient. We can do nutrition services, we can do social work, behavioral health. We have so many staff members here that are working together as a team, whether it's the nurse manager, or the center managers, or the other providers. You can see that they really do care about the patients. Another good thing about ArchWell Health is we get quality time to spend with our patients. I'm able to use that time to build that rapport and come up with a plan where we can get the outcomes that we want. So I founded an organization called Brother to Brother here in South St. Louis City about 3 or 4 years ago. The aim of the organization is to be a role model for the high school males. So with Brother to Brother, we bring in members of Alpha Phi Alpha fraternity, the 100 Black Men of St. Louis, and other positive role models to come into the school, and I try to bring information about HIV and AIDS, about teenage pregnancy. We teach them how to tie their ties, how to shake their hands, how to look people in the eye when they're talking. Some of the life skills that you need every day in order to be successful, sometimes they may not have those or need to be revisited. And so I have a great time doing that in terms of just being a role model.